Welcome. Thank you for your patience. My name is Kirsten Parsons. I'm with the Ingleside team. We are attempting today to have the most panelists that we've ever had on one of our Zoom webinars. So as you're logging in, I appreciate your patience with our team. Again, we've got the most clinicians that we've ever hosted on a Zoom call. So I'm going to go ahead and introduce the Ingleside team and what we're doing, and then we'll be joined by 4 of the team members at Sunday Health, a medical practice that specializes in early cognitive change. So we are so grateful to have you on the call today, and we are recording today's webinar. So if you join late or someone that you wanted to share this with wasn't able to attend, we will have that recording. So the Ingleside Communities, we are a nonprofit organization. There's 3 life plan communities. We're located in DC, Maryland, and Virginia. And we are providing independent living services, assisted living, memory care, skilled nursing. We have short-term rehab, long-term care. We have home care services, both in our community and the greater communities. And then we also have some tailored concierge services that we've rolled out specifically with our waitlist members in mind, but now open to the greater communities. So I'll share a little bit about all of that with you today. So if you are just logging into the Zoom call and you are wondering if you're in the right place and you have joined Brain Health Breakthroughs, you're in the right place. We are so pleased today to have the team from Sunday Health, Dr. Clay Ackerley, who many of you are probably familiar with, Dr. Sarah Doyle, and Dr. Doug Elwood will be joining us today as our clinicians on the call. I do want to draw your attention to some of the, it's small print, but you can find it online as well, some of the events that are featured below their images on the screen. We actually are in the midst of a series, Navigating Dementia in 2025. So this is 6 online sessions that Ingleside is hosting, all related to variations of brain health, considering moving to a community, solo aging. So it's a great lineup from January to June. So please do check out the rest of these events online, inglesideonline.org/events. And you can always call the sales office as well, and we can register you. So I did mention that we have 3 communities, 1 in DC, 1 in Virginia, 1 in Maryland. We are all 3 nonprofit life plan communities, each offering independent assisted memory care, skilled nursing, and a social day program for early stages of cognitive change. So if any of those areas is the right area for you to receive more support, even if it's not a community, but it's something like the social day program that your loved one can participate in while they are still living at home, we would be happy to answer those questions and help you find out more. Just a little bit about each of these levels of care. I know that when we talk about them briefly, independent living and assisted living, it can all sound like jargon within a kind of a healthcare field. But really, I'll just share with you, independent living is a lifestyle that is non-medical. And so an individual is not receiving 24/7 nursing support. Once we start talking about assisted or nursing care, we are talking about having nursing team members present 24/7 in that neighborhood and in their residence. So not the same as a one-to-one companion, but you've got multiple different layers of licensed staff within that level of care. Memory support assisted living is what we call it in the Ingleside communities. That is a memory care residence. It is secured, does have specialized programming specific to an individual experiencing cognitive change, but it's still at the assisted living level of care, meaning that individuals are not totally dependent for their care needs. They're able to participate in quite a bit of their care plan and live quite an active day. So from just the outside, it looks a little bit different from, for example, a long-term care or nursing setting where someone might be very dependent on nursing staff. And then we do offer short-term rehabilitation. So following a hospital stay, if someone were to need just a few weeks of physical therapy or nursing support, we offer that in our communities as well. Ingleside at Home is our care agency that's able to support our residents as well as the greater community. If that's something that you've chosen to bring support into the home, please reach out to us. We'd be happy to share more information about Ingleside at Home. And Ingleside Engaged, which I've already mentioned as our social day program, something we're really proud of. We're able to help individuals who are in the earliest stages of cognitive change enjoy an active day for about 5 or 6 hours. It's different in each of the communities. And that's exercise, music therapy, lunch, and other social programs with individuals who are also experiencing some type of cognitive change, but really able to live an independent lifestyle and just really benefiting from the social engagement aspect. It also gives their primary caregiver some respite needed during the day. And lastly, our concierge service line. This is something very new that we've rolled out. Many of our waitlist members are eagerly waiting for their apartment home and would benefit from some chef prepared meals, dog walking, a recommendation for a plumber. So this is kind of our way of saying, here's all of our vendors that we love and trust. We can kind of tailor that to you for what you need and manage that process for you, even ahead of someone moving into our community. So it is open not just to waitlisters now, but to anyone in the greater community who would benefit from these services. That really does support somebody who is committed to aging in place, but would benefit from some concierge services. Lastly, I want to mention that Ingleside is a proud sponsor of Sibley Senior Association. So if you're in the DC area, you certainly are familiar with Sibley Hospital. You may be less familiar with their senior association. They put on some great conferences every year. This Saturday, February 22nd, is their free conference it's an annual conference on healthy sex at any age. So it is virtual, it is free. If that's something that you're able to attend, we strongly encourage it. They always have a great lineup of speakers. So again, there's information for that online. There's also a phone number here you can call. I always like to provide my cell. I know there's questions that can come up afterwards, so you're welcome to text or call me. My number is there on the screen, and I'm going to hand it over to the team at Sunday Health. We're so happy to have them on the call today. As I shared at the beginning, you are in the right place if you are logging in to join us for this brain health discussion with the team at Sunday Health. They're a medical group that specializes in early cognitive change. So I'm going to turn it over to Dr. Elwood and invite you to share your screen and your slides as well. Thank you all for being with us today. And again, today will be recorded if there's someone that you want to share this with that wasn't able to join live.
Great. Thank you so much. And thank you for having us. It's great to be here. I appreciate everyone on the call for taking their time out of their day to be with us today. I am here with Dr. Sarah Doyle and Dr. Clay Ackerley, and I will let them introduce themselves in a minute. First, I wanted to start with a brief introduction of me and much more importantly, talk about Sunday Health for a minute, and then we are going to get into the meat of the webinar. By way of quick introduction, again, I am Doug Elwood. I'm the Chief Medical Officer for Sunday Health. I actually grew up in the DC area. I did my training in Philadelphia before my residency in New York City. I'm still on part-time faculty at NYU, but have spent the bulk of my career trying to deliver new models of care for individuals, specifically in different subpopulations. And this is a very important one. So I've dedicated my time and energy for the past few years on this issue specifically. Sunday Health is a medical practice, as you can see here, focused on cognitive care. We are live in DC, Maryland, and Virginia. We accept Medicare as well as some commercial insurances, and that list is growing every day. We are very much focused on early stage, and we'll go into that. I should mention we also have a brick and mortar in Vienna, Virginia, a new office location there. And we are a team of cognitive neurologists as well as nurse practitioners and care navigators. And our goal is to prevent and delay the onset and progression of cognitive impairment. And we're going to talk to you about some of the ways we do that today. Before I go into any more, I'd love to hand it off to Dr. Clay Ackerley to start with an introduction, and then we'll go to Dr. Sarah Doyle.
Great. Thank you, Dr. Elwood. It's great to be here. Clay Ackerley. I'm an internist. I'm a primary care physician working in DC and have a lot of patients currently at Ingleside and Rock Creek and plenty of patients who are on the waiting lists for Ingleside as well. So I care for typically older adults, many of whom have brought these challenges to me saying, how do I help optimize my brain health? And I'm a senior clinical advisor to the Sunday Health team and very excited to be here with you today. So I think with that, I'll pass the baton over to Dr. Doyle.
Good morning. Thank you, Dr. Ackerley and Dr. Elwood. It's nice to meet all of you virtually. My name is Sarah Doyle. I'm a neurologist and joined Sunday Health in the last few months to work on building out the clinical program, both for seeing individual patients and then and developing a really tailored approach, and then also developing out broader education efforts for the community. I am a neurologist trained in also in preventive medicine. So an early focus is, at my heart and core of what I do. Currently, I'm in San Antonio and see a lot of patients who are in the early stages, either worried about their memory, have a strong family history, or starting to notice some cognitive impairment.
Great. Thank you, Dr. Ackerley and Dr. Doyle. Appreciate you again being on the call today. So just to give everyone a lay of the land, I'm going to set the stage just for a couple minutes around what we're talking about more specifically. And then I'm going to moderate a discussion with Dr. Doyle and Dr. Ackerley on some specific topics. Again, the title of today's talk is Brain Health Breakthroughs, the latest in prevention, detection, and treatment. And as part of the logistics here, just throwing up a couple things around submitting questions. If you do want to submit a question, it can be anonymous. Just please select the send anonymously box before you do that. There is chat available for assistance, which is not anonymous. And you can turn on captions. If you go to the bottom of your screen, there is an option there that says show captions. So with that, just wanted to, again, thank Ingleside for having us here today. And just to briefly set the stage, when you think about cognitive impairment, the way I like to talk about it with individuals is really aligning it with other areas that a large swath of the population is very familiar with, like heart disease, for example, or diabetes, in where over time changes happen. As we know, as we get older, lots of different changes take place. It's no different with our brain and our memory, but very much like with heart health, there are things that exacerbate or expedite those changes, and those can be prevented and delayed in a lot of ways. And that's what we're going to be talking about today, is how to do that, the importance of that. And again, very much like heart disease, there's a shift in how we're approaching it that's very important. And we're very energized and excited about these changes because they can lead to prevention and delay in this area. So we also feel like there is right now, as we look at the kind of normal paradigm of care for these individuals, not only has there been an overemphasis on the reaction component of this, looking at moderate to severe dementia when it's already kicked in, the memory changes and the dependence on loved ones for care, but also just the framework of how a lot of times primary care doctors aren't in the best position to manage this disease fully, and neurologists are kind of stuck in the position of diagnosing and then handing back, and there can be some problems with communication and just coordination of that care. So we're really lucky to have both the primary care physician perspective on here with Dr. Ackerley and the neurologist with Dr. Doyle, because we feel at Sunday Health that there's a really nice way to bring those together, which is what we've tried to do and is exemplified by the panelists we have here today, and how we've crafted our team. But there is a way to bring that together to just simplify the process, to help with coordination and move individuals through this continuum much faster so that we can get them to diagnosis and start aggressively preventing and delaying, as I mentioned. So with that, why don't we get into it? I'd love to start with you, Dr. Doyle, if you don't mind just taking a step back with us and starting to explain what these new biomarker tests are and why they're important.
Yeah, absolutely. I have a few slides I'd actually like to share, which I think might be helpful graphics to set the stage. So to back up a little bit, we often think about cognitive aging or cognitive abilities as a spectrum, which can change over time. And it's influenced by your genetics, by your environment. And we think of environment broadly as both, your physical space, but then also the body's environment and different diseases or things you've been exposed to over time, and then your experiences, which can, modulate both of those things. So bear this slide in mind, and we'll keep going. So let's talk a little bit about dementia and mild cognitive impairment. Dementia is, broadly speaking, a loss of memory or other thinking abilities that's severe enough to interfere with daily life. And there are many causes of dementia. Alzheimer's disease is one, and it's a common one, but there are several other causes, which you can see on here, like vascular disease or Lewy body disease. Next slide, please. And mild cognitive impairment is an umbrella term, again, for the loss of memory or other thinking abilities, but it does not yet interfere with your daily life or function. Things might be a little bit more challenging, but you can still do them. Early stages of the same diseases, Alzheimer's or vascular disease, can cause this, but importantly, other factors like poor sleep or anxiety or medication side effects, to name a few, can also bring out or worsen symptoms from these diseases. So recognizing cognitive impairment, mild cognitive impairment, is important because we have more tools to make these diagnoses. And I promise we will talk about this in a second, but we can focus on treating these other factors that worsen cognitive function. So can you go to the next slide? Perfect. So we think about cognitive function as a spectrum, like I said, from the graph a couple slides ago. And in the last couple decades, researchers have found that the pathology actually starts to build up in the brain well before you start to have symptoms. So for Alzheimer's disease, this can be 10 to 20 years or more before the symptoms start. So the question is, how do we know that the disease is starting? And so for many people, this involves a neurological exam and cognitive testing, but this is also now where biomarkers come in. And a biomarker is a lab test or a brain imaging or clinical test like blood pressure that gives us information about what's going on in the body or in a specific organ like the brain. So examples that you might be familiar with are LDL cholesterol or the bad cholesterol, or hemoglobin A1C measuring blood sugar control. And for Alzheimer's disease, the biomarkers that we measure, they measure the buildup of two specific proteins in the brain. And for a long time, the only way to test for these was spinal fluid. So this meant getting a spinal tap, or with highly specialized, meaning highly expensive, brain imaging. But now we've got blood tests that can measure if someone has Alzheimer's pathology building up in their brain. So this is exciting. I mean, this is the first time that we've been able to more easily diagnose Alzheimer's and potentially diagnose it earlier before the cognitive symptoms start to get severe. I guess one other caveat I would add is that these tests are not yet approved by the FDA, and so testing still requires at least some payment out of pocket. We expect this to change soon, but at least right now, that's where it stands. And there's also ongoing research about specific prognosis, meaning, how do we interpret a positive test? It doesn't necessarily mean you'll get dementia next month, but really clarifying what the next 3, 5, 10 years are going to look like is an active area of research.
Thanks so much, Dr. Doyle, and appreciate you taking a step back too and just laying the framework for what biomarkers are in general. Dr. Ackerley, is this coming up in your conversations with patients, or are you hearing about biomarkers, and how do you navigate those discussions? And sorry, Dr. Ackerley, I think you're still on mute there.
Sorry about that. Absolutely. They do come up frequently. And I do think that part of again, taking a step back, the level of excitement here is that combining the biomarkers, what we're going to talk about treatments and newer treatments in the pipeline, has changed the paradigm from when patients walk in, are scared to have a conversation about their brain health, don't want to talk about their brain health, would rather have their head in the sand and say, well, I can't do anything about this anyway, so why would I want to know what my risk is? And this is all changing in a way that is fairly rapid and exciting, so that we can begin to have these conversations in a meaningful way that can impact and improve one's long-term health. So from a diagnostic perspective, it has always been challenging to say, what is your risk going to be? Do I have Alzheimer's pathology in my brain? And as Dr. Doyle mentioned, the standard tests to date have been either really expensive or invasive with spinal taps. So the blood tests are easy, familiar. Yes, they're still in a quasi-research phase. They can be expensive, and we're still trying to tease out exactly what a level X means, a level Y means on these tests. But patients are interested. When I find and I order these tests, to be frank, I'm typically then sending patients to Sunday Health, because even as an internist and primary care physician who cares a lot about this topic, I need help and I need expert help. And if you've got a neurologist around the corner who will see you tomorrow, fantastic. But I often, evaluate this data, these blood-based biomarkers, in the context of other things, including cognitive testing, baseline brain imaging, to say, okay, we were thinking that maybe you've got an amnestic, Alzheimer's type MCI or early dementia. These blood tests really help with that diagnosis. But for the most part, patients are now increasingly interested, and I'm certainly glad to have Sunday Health as a partner to help both interpret and include this information in my patients' care plans.
Thanks, Dr. Ackerley. And I think that captures also just both of you expressed the excitement around this, and just drawing back to my comments around cardiovascular care or heart health as a proxy, the idea and the ability for us to get a blood-based biomarker to be able to leverage that in understanding where an individual is in their journey is really powerful. And that's, as Dr. Doyle mentioned, from an LDL perspective or blood pressure, our understanding and our ability to get in there and as clinicians really become proactive. And of course, as you along with us on that journey. So it really changes the conversation and the ability to do that. So really exciting. And along with these blood-based biomarkers are also treatments. So Dr. Doyle, I'm going to turn to you again, if you don't mind, talking about some of the disease-modifying treatments that are coming out and giving us a bit more detail on that.
Absolutely happy to walk through that. So these treatments are actually the first treatments in a while targeted to Alzheimer's disease. And so just to give you a brief, timeline context, the first medication that showed some benefit to help with memory but didn't slow anything down was approved nearly 30 years ago. And then there's just been a big time lag. And this time lag is just research. But time lag until we've got these two medications now, lecanemab and donanemab, that have both been approved to treat Alzheimer's disease. And these are the first treatments actually to show some benefit to slow cognitive decline from Alzheimer's disease. So this is hugely exciting. The way these drugs work is by binding to and removing one of the proteins that builds up in Alzheimer's disease. These treatments involve getting infusions every 2 weeks or every 4 weeks, depending on the medication, for about 1.5 years. And then you'll also get regular MRIs of your brain during this period to monitor for any changes related to treatment. So that's kind of the nuts and bolts of it at a high level. Of course, there's always a caveat. They aren't miracle drugs, so they do slow things down, but they don't stop or reverse the cognitive decline. I'm sure now that we've got the first medication, there will be something far more effective in 20 years, but I know that the neurology community is really excited to have something to offer, especially as a companion to the better testing that we have. Better testing, we also have treatments to go along with it. So yeah, that's a high level.
Great. I appreciate you walking us through that. And Dr. Ackerley, as you look at the broader research space, and Dr. Doyle mentioned it's been quite a long time from a therapeutic perspective, but as we think about the other factors in preventing and delaying, can you speak to some of those and what we've learned recently from things like the Lancet Commission, for example, and the importance of different activities in prevention and delaying, and just how the field is, again, progressing quite rapidly?
Absolutely. And I think as we think about preventing and delaying cognitive impairment, there are a lot of aspects to it that are important. One piece of it is understanding your risk going into it. Some aspects of the prevention strategy I have patients roll their eyes at me and say, some of those things you've told me to do already, right? Don't smoke. Don't drink if, or drink it, reduce drinking if you drink in excess, sleep optimization, exercise, social engagement. All of those things we know improve one's brain health. And as you mentioned, the Lancet Commission looks at all of this data regularly to help the community understand where is the science at the moment. But even since the last Lancet Commission, there's so much interest and so much research in this area that it's exciting to see, and it helps add nuance to some of the recommendations that we're making, where we only have so much effort in the day. And maybe I really enjoy that one drink of wine at night. Do I really need to do that to prevent dementia? Maybe not, given your risk and other things that are involved there. If you do have sleep apnea and you're not sleeping well, then yes, maybe we prioritize that area in terms of sleep optimization. But a study that came out just a couple months ago, it's not definitive per se, but that the shingles vaccine of all things can help reduce the risk of dementia. Okay, that makes sense to me, because a bad case of shingles has a lot of systemic inflammation, including brain inflammation, that may trigger ongoing decline. So as we talked about the blood-based biomarkers, looking for amyloid protein and the amyloid hypothesis in terms of how do we then treat the amyloid protein in the brain, a lot of energy on the inflammatory processes in the brain. How do we reduce inflammation through treatment of diabetes, through exercise? Some of the things that were noted on that slide that I think came up very briefly. How do we treat mood? There is a concept called pseudo dementia, where if you are depressed, your cognitive function is so reduced. If we can treat that depression, that will improve one's cognitive performance. Hearing aids not only improve cognitive performance, it looks like it may slow cognitive decline if you have hearing loss. There's lots of things that we can do, a lot of energy in this area. And frankly, it is moving so quickly that I need help. Again, I noted it before, I'm here as an advisor to Sunday Health, but I also am really reliant on my subspecialist to help me understand which of these areas, all of which are important, are most important for my specific patients in those specific moments to help support their brain health.
Thanks so much, Dr. Ackerley. And I do have a follow-up with that, but I also wanted to just quickly say that I see some questions coming to the Q&A. Thanks for everybody who are posting those. We do have a specific Q&A section at the end, but hopefully some of the questions will be answered as we go along as well, including the one around kind of further diagnostics, but we'll come back to those as well. But Dr. Ackerley, while we're still on the topic, just wanted to ask you quickly around, since we're talking about some of these modifiable risk factors and how to go at them. And one question we get a lot is when to start. And I know I've heard you talk very articulately about getting a baseline. Can you explain that a little bit more? What's the importance of that? And why should someone do that?
Absolutely. I know it can be intimidating to raise one's hand with a primary care physician and say, I'm interested in my brain health. Let me understand where things are. And no, when you do a cognitive assessment, it's always nice to hear that you're normal. I have a lot of patients who, is that you're average. They got A+ in school all the time. I know it can be intimidating to look in a mirror and do that sort of assessment, but it's extraordinarily valuable because, after having the flu, you're going to feel brain fog, for some time, and then that's going to recover. Your cognition will go up and down. But trying to find a moment where you're feeling as normal as possible to say, okay, give me a baseline, so that 2 years from now, 5 years from now, you're like, well, actually, I'm feeling some real changes. How can we compare that to where you were in the past, both with cognitive assessments, with brain MRIs? I mean, the power of a brain MRI is, I think, underappreciated in the community, where we can look for signs of vascular risk and mini strokes. Yes, tumors do occur, excess fluid. It's surprising in my practice alone how often I have found a concept called normal pressure hydrocephalus, which is excess fluid on the brain and can lead to cognitive impairment. So getting an imaging baseline, so that then again, down the line, when you raise your hand and say, I'm noticing some changes. I have some patients who's in the middle of a workup for concern, and some of their brain structures look a little abnormal, but were they born that way? Right? And the change is more important than the actual, result itself. So if you don't have a baseline, it makes it really hard down the line to give that level of personalized medicine that we all, hope to achieve. So I think as part of a baseline as well, the new blood-based biomarkers, as Dr. Doyle mentioned, we're learning a lot already on how to use them. I think they should be part of a baseline, probably, and then trend those over time, as well, and see how those might change, with time as well.
Perfect. Thanks for running through that. And I do see a couple more questions have come up. Again, thank you for sending those. I'll try to address a few of them. Before we get to those, I see one on the medication chart that Dr. Doyle showed before. If we could just bring that back up again, that would be great to answer that one. And as we're doing that, Dr. Doyle, if you don't mind just talking briefly about everyone's busy, obviously, with their day, but if you could dedicate 30 minutes, an hour, what would that look like from an activities that you could do for kind of brain health actions? And I know we've talked about it a bit, but just to flesh that out a bit more.
Yeah, absolutely. I think one thing that impacts a lot of different risk factors is exercise. And I even cringe saying it out loud because everyone's like, yeah, I know I should exercise more. But exercise impacts your mood. So anxiety and depression both can cause slower processing. You just feel like you're slower, the thoughts are coming slower. It can cause problems with your attention. It can cause problems with memory because both of those other things are affected. So exercise can help with anxiety, can help with depression. What else? Exercise can help with getting better sleep. A lot of people, as they get older, notice that they have trouble falling asleep, or more importantly, trouble staying asleep. They toss and turn at night. Addressing anxiety and depression can help that. Getting more aerobic exercise and weight training exercise can help with falling asleep and staying asleep. Getting deep sleep is really important for your brain's metabolism, and is not getting enough sleep or not getting good high quality sleep is definitely linked to worse cognitive function. And exercise helps the rest of your body. There's a lot of research now in terms of, heart failure or diabetes or hypertension, all these things that start earlier, you recognize earlier, and they make it more likely that your brain, your cognitive function will decline over time. And so really getting real with yourself of like, how much do I actually exercise? Even though I know it's important, making it a habit in your day, I think can be hard. But I think it does touch so many different facets of things that are important for your brain, important for your memory and thinking. If you had to spend, and again, I start with that one because it does directly affect something else, which is sleep. And I think sleep issues, if you haven't had them yet in your life, if you ever have, you're like, oh my God, I've just been, the next day, everything just moves slow. You just feel so gummed up. And when that happens chronically, or when that happens in the context of something else going on, it can just be a lot worse. So I think focusing on exercise and then, adjacently focusing on sleep are two of the things that I think everyone could benefit from.
Great. Thanks so much, Dr. Joel. Dr. Ackerley, anything you'd add to that? I know you already spoke to some of those already.
No, I was going to say exercise for the exact same reasons as Dr. Doyle, as annoying as it is. And if you are listening to this and you're like, man, that's so annoying, and it's always been hard, I would give yourself a little bit of grace, but also then dive in a little bit deeper and just find, spend that energy to understand why. Is it pain? And how do we treat the pain, and change your definition of exercise to find things that don't hurt? And if you just hate walking, then find other ways to get little exercise snacks in, slow build up. But I have to say, yeah, exercise is a major key to unlock a lot of other benefits. And then I know it doesn't answer this specific question, but if there's anything to do like right now, again, I would argue to get a baseline, right? Is just to spend the energy. It's a little bit more than 30 minutes. It's not a daily activity, but but to raise your hand, talk to your doctor about it. If you're in the DC area, maybe pick up the phone and call Sunday Health to understand, have someone walk through with you. Is your exercise suboptimal? Is your sleep suboptimal? What else? So you can tailor those 30 minutes daily to the areas that are going to be highest impact to you.
Perfect. Very important message. Going to some of the Q&A and just reminding everyone that you can post it. If you want to do it anonymously, just click the anonymous button before you send a question. Dr. Doyle, there's one question about additional diagnostic testing. At Sunday Health, we do a full armamentarium of testing from assessments, both screening assessments and diagnostic assessments, as well as neuropsychological testing, of course, brain imaging and some of the biomarkers, as well as other blood tests. Do you mind, Dr. Doyle, quickly talking about kind of assessment versus diagnostics and what a screening tool is and used for versus a deeper diagnostic, and along with that, then kind of the how to think about that from a framework when you're talking with your primary care doctor and potentially with Sunday Health?
Yeah, that's a really good question to clarify. So I would say there's, 3 different kind of buckets of testing that we do. And the first one is, talking to you and saying, what are you noticing? And kind of getting a good sense of like, what does your life look like? And these are things, asking about all the things that we talked about, what's your medical history? What's your family history? Does dementia run in your family? And this is all, it's not only getting to know you, it's really influencing, okay, what do we think is possibly or likely going on? And, what testing, if we're not going to do, is there any more specialized testing, objective testing that we might do for you? But getting a good sense of your medical history and your family history, and then what your life looks like and what's been going on recently. Have you had the flu recently, like Dr. Ackerley said, and you're feeling just kind of, your sleep's off, you're feeling slow, you're not back to, walking the dog a couple miles a day yet? Or have you had major life transitions or major life events happen, which they're unpredictable, but can really throw off your ability to give devoted attention to something and can make your memory feel bad. Not that that would preclude any or make us not do any testing, but those things are important. I would say the second bucket of testing is the cognitive screening. So this would be the baseline that Dr. Ackerley was talking about. These tests can take anywhere from maybe 10 to 30 minutes just as a screening test, and test different domains. And by domains, I mean different functions of your brain. So we think a lot about your brain and memory, but your brain also solves problems. It kind of keeps multiple things in your head at once so that you can, think about how complex it is actually to make a list, go to the grocery store, get all the stuff, come back, make dinner. Your brain is doing a lot of thinking and reasoning and in the moment decision making. Language, and then also finding your way through, we call it visual spatial, or kind of finding your way through things, and then also your processing speed. All of those things can kind of direct us again towards, all right, does this look a little bit more like it might be an Alzheimer's picture, where you're having really a lot of problems with your memory, a lot of problems with, storing new memories? Is this more a problem with decision making and what we call executive function? That can become, when I see that, I think much more about, okay, lifestyle. So how is your sleep? I think much more about how is your stress level, because your attention is affected by, if you're cooking on 3 burners, so to speak, it's hard to pay attention directly to one thing and really store that memory. And I also think much more about vascular things. So have you had, as Dr. Ackerley was talking about, a brain MRI? While it's not specific to any one type of disease process in your brain, it can give you a lot of information about, very slowly accumulating vascular disease, which can happen with hypertension or diabetes, or even small strokes that have happened that you maybe never had symptoms from. So that cognitive screening test, if abnormal, you can also do a much more lengthy cognitive test called neuropsychology testing, which again is used to kind of give a pattern of how symptoms, a pattern of cognition. So what are you doing well at? What are you having more problems with? And what diagnoses might fit with that? And then the third bucket is, the lab testing. So this could be blood testing. So the biomarkers we were talking about. Still in my clinic, I do subject people to spinal taps. They're not as bad as the media makes you think, but we still do that because there's other information you can get. And then also imaging. So this would be an MRI of your brain. PET scans are another modality. And again, some of them are specific to certain diseases like Alzheimer's disease or Lewy body disease. And then some of them just give us more of a picture of, has your brain been injured? Broadly speaking, and what might have caused that injury, or is there ongoing inflammation or something like that?
Thanks so much, Dr. Doyle. It's a complicated topic, and I thought that was a very nice rendition of some of the details there, because it can get complicated quite quickly. And another way, just to go back to heart health as a proxy, a lot of times those screenings can be like a high blood pressure. But what's causing the underlying pathology to lead to the high blood pressure could be one of many things, which is why we're excited about the blood-based biomarkers and just getting a deeper understanding with a lot of the assessments that Dr. Doyle mentioned, and even the neuropsych testing, where we can go to a different level of understanding, not just the one parameter of memory, but many different functions of brain health within that constellation of how one is, as Dr. Doyle mentioned, going to the store, doing all these activities, coming back, keeping it organized, those multiple layers, how they affect one's overall daily living. And as both Dr. Doyle and Dr. Ackerley mentioned, how other things like sleep, like mood, can impact that then on top of that. And that all goes into one picture. And while we're talking about this workup and kind of how to approach it, there is a question about costs. We do work with every patient around at Sunday Health around those costs. They can vary quite dramatically. A lot of them are covered by insurance, the blood-based biomarkers included. And in fact, from a blood-based biomarker perspective, the majority of them per major lab companies are actually covered. Some require copay, but up to 70, 80% of testing is covered at this point. So again, very exciting. And of course, that's moving along and should be part of broader coverage coming up soon. There is a question, Dr. Doyle, about the chart with the different modifiable risk factors. If we could bring that slide up again, and maybe just chat about that a bit more. I think it's a couple after this one. There it is. And I think the question is, yep, I think maybe just put this back up actually. So hopefully everybody can see that again. And there are a number that both Dr. Doyle and Dr. Ackerley mentioned as being important in this discussion. Just checking other questions. So we are working with different entities to make sure our data is shared more broadly. Since we're still fairly new, we're still working on that, but we realize, of course, the importance of doing that so that there is a broader collection of data as all of this continues to progress. We are working with companies that specifically offer infusions and clinical trials. So we're very much attuned to what's happening in the broader space and have direct conduits to those for the patients that are eligible and would like to pursue that avenue. Checking to see if there's any, we did drop a post in the chat for those who would like to see that. Gives a bit more detail as to what happens during a cognitive assessment, building off of what Dr. Doyle said. Give everyone maybe another minute to see if there are any additional questions.
And while that's coming in, Dr. Elwood, I just wanted to make another comment, which is
Absolutely.
I know this is intimidating. If you're listening to, this webinar, you probably have someone in your family, yourself with some concern, or you're a really proactive individual, which is fantastic. But I hope you take away from this some data point to then enter into your daily life, because there's whether it's just, again, diving in with your primary care physician, picking up the phone and calling Sunday Health, going to get a brain MRI, or leaving the diagnostics aside and looking at those preventable risk factors and say, okay, yeah, I actually am going to recommit to exercise. It is a moment where we're learning a ton. We already know a ton to be able to help and support your brain health. So hopefully you have a hint of excitement, positive energy to go and execute some changes after today.
Thanks so much for saying that. It's, again, a really important point, and that's why we're here, is because we're very passionate about that as well. I want to spread the message that it can't be too early to start this conversation. Dr. Doyle, one of the questions about that slide was around the percentages. I believe those are broad-based percentages that are not really set in stone, but
Yeah, this is, these are called population attributable fractions, and it's some fancy statistics, but the way you can think about these is that if we got rid of every single case of diabetes on the planet, the prevalence, and that's meaning like how many people out of the total population have dementia, would go down by about 2%. So I think this probably totals up to something like 40%. It has to do with how common something like vision loss or depression are in a certain place, but I think this totals up to about 40%. So the headline from this paper that was very exciting, the first one came out in 2017, and they just updated it again in 2024, was that, if we got good control of all this stuff, and eliminated it in the ideal world, about 40% of dementia cases would be prevented. So this is where I think this was a big shift, actually, in terms of the approach to dementia. I think it's still a mindset shift for neurologists, to speak for us as a little bit of a group. But that's where that comes from. So it's not like, I think the takeaway for anyone listening to this would be like, these are all the things you can look at what's applicable in your own life. You're like, okay, I have been noticing that I say, I'm asking people to repeat themselves a lot more. Should I get my hearing checked? Or I'm trying to think of another one. Some of these things, again, like the air pollution and the education, are much more like on the population level. So this is people who should be focusing on that. It's important for you to pay attention to if you are interested in advocacy or interested in policy. But that's information for our policymakers to say, look, if we're going to take seriously aging populations, we need to take this stuff seriously. The stuff that happened, how many times a day do we breathe? How many years are we in school? But that's where those percentages come from. Fancy statistics.
thanks, Dr. Doyle. See a few questions around where to find a neurologist or medical practitioner who specializes in this area. So most neurologists are obviously part of the conversation, but many of them, or nearly all of them, don't focus specifically on cognitive care. Sunday Health is an organization that is built directly to focus on cognitive care. So we're happy to work with anyone on this call, or anybody who loved ones or friends or family who would like to get to know more about this topic. Otherwise, obviously, there can be a conduit through your primary care into a neurologist. Unfortunately, what we're seeing and hearing, especially in the DMV, but also in many other places, that there's long wait lists sometimes. And as Dr. Doyle described, there's another step sometimes with the neuropsychological testing, which even takes longer. So that's a big reason, again, why we are in existence, is to try to expedite those steps and crunch them down and do them a bit faster. And the blood test, as Dr. Ackerley mentioned, some primary care doctors are doing those, but generally they need assistance in understanding the nuances and interpretation and broader picture. And so that's again where a group like Sunday Health can come in and really help shed light on when to deploy those, how they fit in, and what next steps can be around that. Dr. Doyle, there's one other question about the biomarker test specifically. I don't know that we have time to go into a full review, but maybe, and you did mention that they cover kind of two areas with tau and amyloid, but maybe just provide a bit more context also into the genetic markers, and are we still using those? Are they still important?
That's a really good question. So maybe I'll touch on the genetics first. The genetic risk for Alzheimer's disease is an active area of research. There are some genes, and there's a handful that have been identified as saying, oh, you're at higher risk. So if, say, everyone has a 1 in 100 chance of getting Alzheimer's disease and dementia from that, maybe you have a 2 in 100 chance. So it doesn't necessarily mean that you are definitely going to get dementia from Alzheimer's disease. It just means that you, compared to everyone else, is at a little bit higher risk. For genetic testing, there are some genes that there's a handful that mean you are definitely going to get this. And that's usually for much younger, more aggressive disease. When you get genetic testing, it's important to know that this isn't like we're just going to throw your blood into a pot and see what comes out. We're testing for specific things. So at this moment, February 18th, 2025, we can test for this amalgam of genes. In 10 years, that might be, oh, we were testing for 20 genes then, and now we're testing for 30 or 40 genes. The other part of that too, and this is an active area of research, is, again, just because you have the gene doesn't mean that you're going to get the disease. What are other things that might influence that? So is it that you've got this other gene, that makes it so that one doesn't really have an effect? Is it that there's been some modification to this gene because of your environment that has made it so that it's either more likely or less likely to cause a problem? So I think if you're interested in getting genetic testing, I guess I would first ask yourself, why am I interested? Am I secretly hoping for a negative test, as we all are? Or do I really, but if it is positive, what am I going to do to kind of change up my lifestyle or seek out care or seek out a baseline so that I'm, taking charge of my healthcare rather than, just being depressed because now I think that I'm doomed to losing my memory and all of my faculties as a person. So that's what I'd say about genetic testing. It's still it's evolving. It's important, but it's evolving. And for most genetic tests out there, it does not necessarily mean you're definitely going to get Alzheimer's. For the biomarker test, it tests one of the proteins called tau, but it correlates with the buildup of amyloid, which is another protein. So I'll stop there. It's got a pretty good reliability, or it's pretty reliable, I guess, because it's been validated against some of these other tests that we've used for a long time.
Great. Thanks, Dr. Doyle. Again, a very complicated topic that you're trying to answer quickly. So I appreciate you running through that. And
Dr. Elwood, can I do 15 seconds on it too?
absolutely.
Yeah, totally agree on the genetic testing. It is tricky, and you definitely want to have someone walk you through implications and everything else. On the biomarkers, what's interesting is like the cutoff. So you got tau, amyloid, other neuroinflammatory markers that we're now looking at. And it's tricky when you have low positive, high positive, trending them over time. It does see it not only the data now says, okay, it will correlate pretty well with an amyloid PET, right? And so that's helpful as we think about these newer drugs, who would qualify for these drugs. So it can help treatment. But it's also looking promising that if we track these over time, it hasn't been proven, at least as far as I've seen, hasn't been proven over time, but I think we'll probably get there, just like an LDL marker, if we test these in sequence and we're making lifestyle changes, other things are changing, and we're seeing improvement in these markers, probably means we're onto something that we're going to improve your brain health overall. Again, I don't want to speak ahead of the science at all, but that is certainly my hope, and it looks like that's not unfounded.
Yeah, absolutely. That's a really exciting component of it. So we are nearing the top of the hour. Just wanted to say a few quick things. One, thank you to Dr. Doyle and Dr. Ackerley again. Really appreciate your time and passion around this topic. Two, I know we didn't get to all the Q&A. Apologies for that, but we're open and available at Sunday Health for additional questions. We did drop in our contact information in the chat, and here it is again here. And we are doing another webinar coming up specifically on nutrition. And around diet and cognitive health, which if you want to join that, there's more information here. And with that, we will pass it back to the Ingleside team. Thank you again so much for having us here, and it's been a pleasure to speak with everyone this morning.
Good morning. Thank you all for being able to join us today. We are so happy that we had such a wonderful turnout. Today's session was recorded, so we will be sending that out if you know of anyone you'd like to share this with. Also, if you would like to attend any other of our series that we have going on, please follow us at inglesideonline.org to register for those events. And thank you so much for coming. All right. Bye-bye, everyone.